TIFU by injuring a heart surgeon in the middle of heart surgery. I am an assistant in heart surgery. I work with over a dozen different surgeons. The one doctor is one of the OGs at this place, been around forever, seen it all, done it all, nothing really bothers him. He's very quiet and reserved during surgery. I'm new here, so I'm really trying to make a good impression. The case before I worked with this doctor was literally the smoothest case I've ever assisted. I was truly a step ahead the entire case, and the surgeon didn't have to ask me to do anything, because I was already doing it. It felt so great. So, when I saw my assignment was to work with him, I was super pumped to get a chance to build on how great the previous case went. So, there we are, in the middle of the surgery. The heart is arrested as diastole, the heart-lung machine is cycling the blood instead, and we have the heart literally cut open to replace a valve. Right in the middle of placing the valve sutures into the heart, he handed me 2 of them, and I went to place a hemostat clamp on them outside of the open chest, like I had with the rest of them. This is a routine and imprecise move, so I was kind of nonchalant about it. Unfortunately, the surgeon pulled his hand back right as I went to clamp, and I clamped a motherfucking metal clamp onto his pinky knuckle. He lurched back, and screamed in pain, looked at me and said, "Now why the fuck did you do that for?" I was speechless, being caught totally off guard. Obviously I hadn't done it on purpose. This reserved and quiet surgeon did a just-scored ATD in the Super Bowl spike with the now contaminated with his own blood needle driver he had been holding onto the floor, ripped off his gown and gloves, and stormed out of the room. The entire room was pin-drop quiet. What do we do with this open chest and open heart without a surgeon? What happens now? My career flashed before my eyes. My ears burned like lit sparklers, and sweat started running down my neck. My surgical goggles started fogging up. For a second I felt like I was going to pass out. But 30 seconds later we heard the surgeon slamming the metal panel on the scrub sink, and we knew he was scrubbing back in. He came back in the room a few minutes later, clearly red-hot mad, but we went right back to work. And finished the case without a single word about what happened. When he was getting ready to leave the room, I apologized sincerely, which he kind of resentfully accepted. TLDR. I ripped a world-class heart surgeon's hand open with a metal clamp in the middle of surgery, which really pissed him off, but he washed the blood off and went right back to work like the professional that he is, and I almost died from shame. Edit. Marked NSFW due to the fucking F word and because apparently I'm literally NSFW. Edit for clarification. Don't mistake my comment about being nonchalant as being careless. The point was that I wasn't in the chest, I was back off to the side just clipping sutures together. So it's a different kind of movement than handling tissues inside the chest. My mistake was in having tunnel vision and not seeing the unexpected movement of the surgeon, not in how I was clipping the sutures together. One final edit, Holt shit. I scrub out from a heart transplant today to find that I've hit the front page. So I wanted to add a couple more details. The surgeon was fine, just had the side of his knuckle pinched in. They're tips of a hemostat hard enough to tear the skin a little. I love my job so much, and am pretty good at it. We've worked together since and it never even came up, because he trusts my skill set. Also, if you have any questions about heart surgery, feel free to ask. We do some awesome gnarly shit.